Northern Minnesota has long benefited from government aid from the state in the form of direct grants and property tax relief. But that aid could be threatened in the 1993 legislative session. Despite a metropolitan predominance in the Senate and a strong coalition in the House, Northern Minnesota legislators say the committee structure will protect Northland interest.
Well, we don't have the numbers of people, but we do have a lot of experience, a lot of respect, a lot of power in chairmanships. Almost all of us northeastern Minnesota senators are chairs, and so we've established a lot of rapport with people.
Solon chairs the Commerce Committee. Bob Lassard of International Falls heads the Environment and Natural Resources Committee. Florian Chmielewski is the chair of the Transportation Committee, and Doug Johnson of Cook heads up the Tax Committee.
Well, northern Minnesota legislators never felt intimidated by the bigger numbers in the metropolitan area. And I believe since we have longevity of a service, you have Senator Lassard, who is a longtime member, Senator Johnson, Senator Solon, Senator Chmielewski, and all of the others in the northern part of the state. We have seniority over the metropolitan legislators.
That group alone can effectively control legislation, and with the governor's budget message just weeks away, legislators are bracing for 5 long months of budget debate. The Northland delegation is confident that the Budget Balancing Act will not include drastic cuts for northeast Minnesota cities and counties, but the final tally won't be known until May 17th. At the Capitol, Derek Hines, News 6. Taconite production taxes of $1.90 per ton are collected by the state to provide grants, loans, and property tax relief to Iron Range schools, businesses, and communities. As the taconite industry struggles to survive, massive efforts are underway to cut costs, but the cost per ton is still high. So the taconite industry will soon present a cost-cutting plan to the legislature and ask that the taconite production tax be reduced.
We're going to work with the taconite industry. We have an open-door policy, but we would encourage them to access the $22 million first.
That $22 million available to mines includes tax incentives, revolving loan programs, and new grants from the IRRB, all of which effectively lower the current tax burden.
With the production, with the freeze that we did, the investment credit, and the grant, I think we're below that anyway. All right, so I'm kind of going to wait and see, and we'll go from there.
If the industry and if labor from the taconite industry come down to the legislature with a plan that makes sense, not just tax relief that goes out east to the steel industry, but that actually brings plant improvements and protects jobs in northeastern Minnesota, at least I'm open to looking at that.
While the mines of northern Minnesota struggle to remain viable, the towns nearby must do the same. Cuts in taconite tax revenue could be devastating to small range communities. It has always been difficult weighing the needs of the taconite industry against those of Iron Range cities. The consensus is that legislative action may eventually be needed to save both. At the Capitol, Derek Hines, News 6. Josh Bixler knew right away what he had in his backyard.
Hussy.
What is there?
What's there?
Look, honey.
Here?
Well, Josh made a small moose steak. What did wander into the Bixler's backyard in the middle of a city of 80,000 people was most definitely a moose.
We called 911.
What did they tell you?
They said...
They thought it was a joke.
I called him back just a little while ago, and the guy said he thought it was a joke.
The misguided moose wandered into town, perhaps looking for food after a heavy snowfall, and decided to stay put. Natural Resources officials told the Bixlers to wait and see if the moose would leave.
Yeah, I just called the DNR, and they said to leave him, just as long as nobody's scaring her, and she'll be fine. They're hoping she'll go back north.
The forest dweller was involved in miscellaneous mischief for most of the morning. The Bixlers are worried about what their landlord might think. The landlord said no pets. I wonder if they thought of putting a moose in the lease. So for now, the moose is enjoying a new home in the Bixlers' backyard. But since they already have some pictures for the photo album, they're hoping the urbanized beast will just vamoose. In Duluth, Derek Hines, Moose 6.
I know when he took his truck, they got keys to all his place, because I've got keys. I've got key to his garage, and I got access to that. That's what kind of neighbors we are. And you can't find a nicer neighbor than he'll ever be.
There's no activity on the snow-covered Arrowhead refinery site these days, but along the highway bordering the site, a trench is being dug to house a pipeline to carry contaminated groundwater from the site to the Western Lake Superior Sanitary District for cleanup. Once the pipeline is installed, groundwater from the sludge lagoon will be pumped to the surface, held until it has been diluted with rainwater or snow runoff, and then directed into the pipeline. WLSSD officials say they can easily process the low-level contaminants that will come in with the water.
We've had extensive test results from the site itself, and we've had ongoing monitoring, so we're real comfortable with what we're doing.
This pipeline will carry the contaminated but diluted groundwater for about 4 miles alongside Highway 53 until it intercepts with the WLSSD pipeline.
It's a new type of plastic pipe that's it's durable. It's the first time I've ever worked with it, but it seems like it's a real strong pipe.
The Arrowhead pipeline will meet up with the WLSSD pipeline at the intersection of Highway 53 and the Haynes Road. Workers say if weather stays nice, they should have the pipeline completed within about a month. In Duluth, Barbara Riles, News 6. When Fitkers opened in 1984, its financial backers had high hopes. But things haven't gone well for the complex. Retailers had trouble attracting customers, and most of the original stores are long gone. Eventually, the facility fell into bankruptcy. But now, with a new local marketing company in place and a new strategy, managers are already seeing a positive change.
The office space that we're bringing in is more long-term leases. It's more of the 5-year leases. Than some of the specialty shops, which are 1 to 3 year type of leases.
The strategy is to keep the first 2 floors mostly for retail outlets and market the 3rd, 4th, and 5th floors for office space. The Papillon store is moving into the former Itala outlet, a move that gives it quadruple the space, and the Made in the Shade store has tripled its space with the move. Other new retailers include Northland Optical and a bookstore called Publishers Outlet.
It's going wonderful. The owner likes to be in buildings like this where they have historical aspects to it, and the people here are wonderful. He likes small places like this where everybody's close. Business has been great.
Another interesting development, a microbrewery, which will open in Fitkers on March 1st. Though the Fitkers beer label is already taken, the company will brew its own brand of local beer and intends to market it within the complex. But managers hope to fill the majority of empty space with offices. Managers are taking an aggressive approach to this new marketing strategy and are vowing to have 75% occupancy by May 1st. They're hoping this aggressive approach will help snare some interest in buying the complex from the bank. At Fitkers in Duluth, Barbara Riles, News 6.
Just to illustrate the point I just made to you. Some people look at this and they say, wow, you're at 28 million, in terms of the budget, the rate of increase for the budget.
We have. I think our program is good. I think that we provide a quality educational experience for kids, and we have been doing that for a very long time. What worries me a lot, however, is whether or not we will be able to continue to do that, at this level and at this spending pace. Whether or not we are actually serving our kids adequately. Maybe we are not providing for them all that we should be.
we're not going to stand in the way of people that do have that kind of interest. But in terms of the district, I made a decision, right or wrong. We'll stick with it.
Island Cafe.
Folks on Madeline Island have had their own telephone company for a long time, but the service is less than perfect.
You could be in the middle of a conversation, just simply cut off. Or you can dial and get continuous busy signal all day long.
Although party lines help build rural telephone networks, residents say it's not much fun trying to hold a conversation and suddenly ending up in another. Plus, running a small independent operation is not easy.
Someone will cut the wires when they're digging, so all the phones in that section may be out. We may have a windstorm and someplace there has been a line and phones are out in that section. It's part of it is living on an island in Lake Superior, but the system itself has proved to be totally archaic.
The last operator left the island about 20 years ago. There isn't much left but the switching station. And there isn't much sentimentality around town about taking the next step toward automation.
I don't know. I don't think it's going to make any difference as far as relationships between people. I don't think the phone service. I think that it's going to make a difference in that the phone service will be more reliable. There are people on the island that can't get phone service right now.
And so telephone customers on Madeline Island don't mind ushering in the end of an era where sharing a phone line with a neighbor helped keep a community together. They say they're willing to pay more for a nearby cooperative to run the phones for the island's 160 permanent residents and make life more bearable.
I wouldn't want to put this phone system that we have upon my worst enemy, and that includes Saddam Hussein.
In La Pointe, Wisconsin, Derek Hines, News 6.
Bye.
And she was so kind, and I think of the kindness that she showed us. She then attended McAllister College for a couple of years, and also... You deal with all these people celebrating you.
Well, I look around and think these little kids were about that old when I first came here. And it's been so nice to be here and see them.
We see a lot of poverty, a lot of low-income people, and a lot of working low-income people.
The Northwest Wisconsin Community Services reaches out to the poor in a 5-county area. Its programs include a free clothing store for adults and children, a food shelf system, and the distribution of U.S. government commodities. Director Richard Munson says things are getting worse.
There's very few jobs around. What jobs there are minimum wage. You take the working low income. Both members of the family are working and still below poverty guidelines.
According to the U.S. Census Bureau, Northwest Wisconsin is far higher than the state average in poverty. While the state average is 10.7%, some counties in this part of the state are nearly double that rate. As those statistics just indicated, there are 15,000 people living in poverty here in northwestern Wisconsin. But perhaps the most tragic story involves our children. According to the Census Bureau, in most northwestern Wisconsin counties, 20% or more of children live in poverty.
The sad part about it is they want to be like anybody else, the low-income kids. And we were fortunate enough to get like 100 pair of tennis shoes from United Way last year. It costs us $100, I think, for 100 pair of tennis shoes. And if you could have seen the eyes of those kids, you know, when they received them, you would have thought they were given the world. Because
for a businessman to try to do that on his own and have the time available they needed from the 800 number, a combination of the 800 that are common that the businesses can share with each other. You can be in. It is a lack of information, some fear. Business people are very hardworking people, and they sometimes don't have the time to find out what they need to find out to expand the markets.
Already in managed care plans.
Northlanders say Minnesota's revolutionary health care plan is headed down the right road, but doesn't go far enough. They want to take it the extra mile.
In general, the State Health Care Commission has focused on consumers and providers and the places to get substantial cost savings. The Commission has not taken any serious look at the insurance industry as another area for savings costs.
That's why Lyle Winters and his friends support single-payer legislation. The plan would eliminate all healthcare insurance agencies and create only one to cover all Minnesota residents. It would be governed by the state. Al Netland disagrees with critics who say the plan sounds like socialized medicine.
Doctors would still be operating as individual doctors. It would not be employees of the state. Hospitals would still be operating. You'd still be going to see your doctor, but the administrative functions would change dramatically.
The group expects to receive opposition from insurance agencies and the medical community. Although not convinced, one hospital administrator says that program is on the right track.
I would rather subsidize giving medical care to people than giving salaries to insurance company bureaucrats.
The bill is expected to be introduced to the House committees within the next 2 weeks. In Duluth, Amy Rutledge, News 6.
Huge administrative waste, the excessive fees, and the unnecessary procedures. Single payer is the only.
But come this time of the year, it's kind of a lull. There's not a lot of things for people to do, and this is just a great opportunity for them to get something real nice at a time when maybe they would appreciate it a little bit more.
Oh my, a $2 bill.
I'm gonna keep going until I get one.
Blue Cross fed information on patient records into this computer, tracking them for complication and death rates over a period of years. The computer showed a wide variation in patient outcomes and costs among cardiac care providers. Using the research results, Blue Cross developed a quality-based network.
With that type of data, we're able to look at the complication rate for various types of significant procedures, serious procedures, such as coronary artery bypass grafting, other major procedures.
The network averaged 15 deaths per 1,000 patients compared to the average for the majority of other cardiac care providers in the state of 53 deaths per 1,000. St. Mary's Medical Center and the Duluth Clinic were included because the computer chose them as falling within the guidelines for cardiac care excellence.
I think that we're good because we care about patients. We constantly try to improve the delivery system that we provide for patients. We keep, again, patients as a focus of what we're doing. And with that as a focus, I think we're able to deliver good quality care.
What this means to heart patients in the Northland is that anyone who is insured by Blue Cross Blue Shield's Blue Plus program must make the trip to St. Mary's and the Duluth Clinic in Duluth for just about any elective non-emergency heart procedure. Blue Cross spokespeople indicate this is just the beginning of narrowing medical facilities to which their clients will be able to go. They say it won't be long before anyone holding any type of a Blue Cross policy will be directed to facilities they have chosen based on computerized models of excellence. And the insurance company is also already in the process of gathering data on other types of medical treatments, including things like cancer, high-risk maternity, neurology, and physical therapy. Eventually, the company intends to limit medical center access to chosen networks for those procedures as well. At St. Mary's Medical Center in Duluth, Barbara Riles, News 6.
On these other long-term problems. My message to you is clear. The price of doing the same old thing is far higher than the price of change. After all, that's why you sent me here, not to keep this seat warm, but to work for fundamental